Welcome to the third module in the Visionary Board Leadership Program. My name is Shannon Studden, and I'm a Senior Program Specialist with the National Rural Health Resource Center, a national nonprofit organization dedicated to improving and sustaining the health of rural communities. So far in this program, we've talked about the transition to value and the impact that visionary leadership can have on successfully navigating this transition. We hope you've had some time to continue thinking about what the transition to value looks like at your facility. We also hope that you've had some conversations with fellow board members and others about your vision for the future of healthcare in your community. Today, we're going to continue down the road to value by examining the partnerships and collaborative decision-making that are an important part of value in population health initiatives. As we do this, we'll be revisiting some of the concepts from the first two modules of the program. Just like in previous modules, you'll hear other rural hospital board members and CEOs share their perspectives on these topics. And we'll leave you with some things to discuss with your fellow board members and a few things to pay attention to between now and the next module. So let's get started. One of the underlying assumptions behind the transition to value is that the innovation needed to address challenges within our healthcare system can only come from groups representing many different perspectives working together. Complex healthcare challenges can't be solved by just one organization or area of expertise. Collaboration is key. But what kind of collaboration are we talking about? We can think of collaborative relationships as being on a spectrum of integration. At one end, we have minimal collaboration, where two or more organizations might share some information or provide representatives to sit on a community board. At the other end is a much deeper level of collaboration, where entities make decisions together and share resources over a long period of time. The level of collaboration needed to successfully move toward value and population health is toward this deeper end of the spectrum, where partners make decisions as a group and share resources over the long term.
The healthcare system, we used to have a hospital, and sometimes it was a hospital that basically did its job, might have done a wonderful job taking care of patients when they came to the emergency room or when they were sick or were in beds, etc. The healthcare system of today, especially given the value in population health payments, is really more of a community-based system. And so one of the biggest jobs for a hospital might be to reach out to establish partnerships and relationships with the other services that exist in that community or service area. One of the problems we often see is a disconnect between acute care, the hospital, and the long-term care system, for example. We take care of our patients in the hospital, but very often we lose contact with them as they move into the other service systems. So aging, mental health, public health, etc. The new mandate, the new imperative is for all of these organizations to work together.
When it comes to building partnerships, people at all levels of an organization have a role to play. So exactly what role does the board play in this? The primary role of a board is to think strategically about partnerships. Because collaborating and working across boundaries requires an investment of time and energy, it's not possible to collaborate with everyone. Partnership building efforts need to focus on the entities that are key to achieving your organization's vision and strategic goals. Another responsibility of a board is to set an example when it comes to building relationships inside and outside the organization. For example, board members might represent the hospital in initial communications or meetings with potential partners. Lastly, board members can set expectations that others in the organization work across boundaries as well. This means different things for different employees. For example, while senior leaders may be responsible for connecting with entities outside the organization, frontline employees might be asked to serve on a patient care team that includes clinicians outside the hospital environment. All of these types of partnerships play a role in the transition to value by ensuring that many different perspectives are involved in the process of solving complex challenges.
As I look at reaching across boundaries as a board member, I think organizationally, we look at the partnerships we've established with organizations that supply our specialists. It's a big part of our strategy is to be able to provide some high quality specialists here, surgery here, things that you may not expect. That's the in-hospital side of it, but I think externally, when you look at things, we have a YMCA that grew out of an initial fitness center that was built by the hospital that frankly kind of got outgrown. And it was something that we could not tackle on our own from a financial standpoint. We had to be looking to other areas, and the community came to the decision through working with the community foundation, working with the schools, working with the city, other donors, and all different stakeholders, and we were able to share some space and some knowledge, and the fundraising came from the community foundation, shared spaces with community or public entities, and we were able to come up with a tremendous facility that was able to serve everybody's needs better than our small facility was. And that changed some things with the way we operated, but I think it's been a tremendous benefit because it touches everybody.
Collaborative partnerships look different in every organization and every community. But one thing they have in common is that they're created to support the vision and strategic goals of each partner organization. For example, as part of some initiatives to improve health outcomes for a specific population of patients, hospitals have mapped out patient touchpoints by identifying all of the entities that a patient interacts with before, during, and after a visit to the hospital. This exercise can help to identify the strategic partners who might play a key role in improving health outcomes. Some groups working to improve outcomes for patients with diabetes, for instance, have chosen to partner with social service agencies, faith-based organizations, and mental health providers to address the issue. Through their work together, group members learn more about how their partners interact with individuals with diabetes, work together to develop a vision for the partnership, and create a plan that takes all partners' perspectives into account. So that's one hypothetical example. Let's hear about some real-world examples from our interviewees.
So I think as we have shifted to value and looking at population health, I think that has broadened our view of who partners really are. Healthcare has traditionally looked at our other providers as being partners, our tertiary care facilities that are on the outskirts of where we are, that we send our patients to, our physicians, our specialists, we're all in this healthcare delivery together. But I think that we're starting to look even beyond that as to who else is becoming partners in how care is occurring, because it is more than just care delivery. Health is about access to recreational facilities. It's about access to healthy food. It's about access to a safe environment to walk or to live in. It's about all of these other things. And so how we work within our community to make that the best is where we're starting to see us branch out. We are working very closely with our local government, and we call them parishes in Louisiana, our county government, where we're trying to combine the work that they do to make sure that their citizens are taken care of in terms of the senior care and the council on aging, but also with recreation and how we're addressing those areas and making outdoor activities and healthy behaviors part of our lifestyle. So we're working with them to do that in a collaborative way where we're focusing on health and wellness together, and it's not two separate entities doing two separate things.
On a number of our initiatives and projects we've decided to work on. One of them was reducing the stigma of mental health, and we chose to implement the Make It Okay campaign. And we knew that in order to be successful at driving any change within the community on that, we really needed to have community members involved in making the decisions. So we put together a group of people that was pretty diverse within our community. It involved everyone from the mayor of our local town to the CEO of an electric co-op, We were able to bring in past employees and physicians from the organization, community members, members from our local arts community. They were very passionate about it. We were able to get them excited about it. They went out into the community and attended local parades. They put on music events, have done a lot to help make a positive impact that the hospital on its own probably wouldn't have been able to do.
In these partnerships, there isn't one person or organization clearly in charge. Partners work together as peers, rather than in a hierarchy where one or more partners has more power than others. In circumstances like this, trust between partners is crucial. Trust can take a while to build, so partnerships can be slow to develop, especially when entities haven't worked together before.
We reached out to the Housing Authority because we as a hospital were having trouble recruiting employees because there was not adequate housing for them. There is some properties available for people with low incomes, but the future employees usually did not have income at that time, but as soon as they became employed, they would have income, so they couldn't use those subsidized housing units. And we don't have a lot of opportunities available for people who are starting out. So we thought that it would be wise to talk with the Housing Authority and see what our actual needs were in the community.
You know, some of the stakeholders that you think of are schools and the city and the, foundation, because they're helping you to bring in money. We closed our fitness center because there was a Y that was coming into town. And so there was really a community-wide effort that wanted to have a Y, and that was important for recruitment, that was important for children, and so we decided that we needed to be a community partner there. And so we're working with extension agencies, we're working with other licensed mental health practitioners, we're working with providers, we're working with all the people that might touch a person in some way. So, getting together, we have interdisciplinary meetings where we talk through things. So that's where we sort of find out, well, how can we play a role in this overall effort? So it is being involved. Is it, even with faith, we have faith, we have a ministerial association. So in our community, we have different faiths. We have a Somali population. About 14% of our community is made up of Somalis. And so they're Muslims primarily. And so making sure that we have a relationship with the community leaders within their religion and faith. And so we did seek out their input so that we could better understand what they wanted, what they saw us as being able to deliver. And so you do need to have those relationships with folks in the community, particularly when your community is diverse. You need to know what's important to them. And so it's usually involving faith-based organizations. It's usually involving schools and city and other providers and and food banks and businesses. Businesses want to know how they're going to be impacted too.
In the early stages of collaboration, it's important to devote time for partners to learn more about each other and share perspectives on healthcare challenges. Early discussions might center around things like how partners interact with patients when they're not in the hospital, reviewing population health data and drawing conclusions together, sharing perspectives on the most pressing challenges to improving health in the community, and how the group's work can mutually benefit all parties. The foundation for trust is laid when partners are each viewed as holding an equally valuable piece of the puzzle, and all parties know that they are participating in a mutually beneficial relationship. In our next module, we'll continue to build on the topic of visionary leadership by exploring ways to effectively communicate inside and outside the organization and inspire enthusiasm and buy-in for your vision. Between now and then, however, we'll ask you to consider these questions and share your responses to them at your next board meeting. As board members, how do you currently reach across organizational boundaries? What expectations do you have of senior administrators related to engaging with other organizations? What organizations do you currently partner with? How are these partnerships aligned with your facility's vision and strategic goals? And what other organizations might be part of the puzzle of population health in your community? What value might these organizations bring to the conversation, and how might you best connect with them? As you contemplate these questions over the next month, we encourage you to consider talking with other organizations in your area to learn more about their views on population health and the services they provide to community members. These conversations may provide you with valuable insights into the broader systems view of healthcare in your area, and may spark some thoughts about the contribution that potential partnerships could make to improving health in the community. For additional information and resources on any of the topics covered in this module, see the resource guide that accompanies this program by searching for Visionary Board Leadership within the Center's resource library. And of course, please feel free to contact us at the Center anytime for additional support. Thanks for joining us today. We look forward to continuing the conversation over the next few months.